Aclopsa Aceclofenac, a comprehensive guide to safe and effective use. Aclopsa is a pain reliever, fever reducer, and anti-inflammatory medication belonging to the nonsteroidal anti-inflammatory drug NSAID class. It is prescribed for the treatment of pain and inflammation associated with various conditions, including 1. Mechanism of action. Aceclofenac, the active ingredient in Aclopsa, is a nonsteroidal anti-inflammatory drug NSAID that works by inhibiting the production of prostaglandins, which are substances that mediate inflammation, pain, and fever. 2. Dosage and administration. Typical dosage 100 mg, twice daily. Administration: take the medication with a full glass of water, after meals to minimize stomach irritation. Duration of treatment: this will vary depending on the severity of the condition and the patient's response. 3. Dosage considerations. Patients with liver impairment, no dose adjustment is usually needed. Patients with kidney impairment, no dose adjustment is usually needed. Elderly patients, caution is advised when using the medication. Starting with a lower dose and monitoring the bolus response may be necessary. 3. Dosage considerations. Children. Aclopsa should not be used in children under 18 years old. 4. Side effects. The majority of adverse effects associated with Aclopsa Aceclofenac are uncommon and, if present, are usually mild and reversible. Patients taking Aclopsa may experience the following symptoms: gastrointestinal stomach pain, nausea, indigestion, bloating, constipation, gastritis, diarrhea, etc. 4. Side effects. Nervous system: dizziness, headache, skin itching, rash, hives. Laboratory tests: elevated liver enzymes, blood creatinine. 5. Contraindications. Aclopsa is contraindicated in individuals with known hypersensitivity to aceclofenac or any other component of the medication. 5. Contraindications. Aceclofenac is also contraindicated in people with a history of allergic reactions to NSAIDs, aspirin, manifesting as acute rash, acute rhinitis, or the occurrence of asthma attacks, or other allergic symptoms. 5. Contraindications. Aclopsa is contraindicated in patients with active peptic ulcer disease, gastrointestinal bleeding, severe heart failure, severe liver impairment, and severe kidney impairment. 6. Precautions. Patients with liver or kidney impairment, close monitoring of liver and kidney function is essential. Elderly patients, caution is advised when using the medication. Starting with a lower dose and monitoring the bolus response may be necessary. 6. Precautions. Pregnancy and lactation: avoid use during pregnancy and breastfeeding, except when strictly necessary and under the guidance of a physician. Patients with asthma, cardiovascular diseases, kidney disorders, liver diseases, use with caution and under the supervision of a doctor. 6. Precautions. Patients taking other medications, inform your doctor about any medications you are currently taking to avoid drug interactions. 7. Drug interactions. Aclopsa may interact with several other medications, including anticoagulants, diuretics, ACE inhibitors, antibiotics, antifungal medications. 7. Drug interactions. Cancer medications, cardiovascular medications. 8. General considerations. Do not self-medicate without a doctor's prescription. Adhere to your doctor's or pharmacist's instructions regarding dosage, administration, and duration of treatment. Report any side effects to your doctor or pharmacist for prompt advice and management. 8. General considerations. Store the medication in a cool, dry place, away from direct sunlight and high temperatures. Keep out of reach of children. 9. Additional information. Aclopsa may cause gastrointestinal side effects such as gastritis, peptic ulcer disease, and gastrointestinal bleeding. If you experience stomach pain, nausea, vomiting, or black stools, stop using the medication and consult your doctor immediately. 9. Additional information. Do not use Aclopsa for prolonged periods or in higher doses than recommended. 9. Additional information. Important note: the information provided in this article is intended for informational purposes only and does not substitute for professional medical advice. Consult your doctor or pharmacist for personalized advice and treatment.